welcome you all to this live session. Hello everyone. Hi everyone, this is Divya and I welcome you all to this live session that is Pranayama for respiratory health. And as we all know that monsoon has started, as the monsoon comes in, it brings a lot of diseases. Like it brings many diseases due to viral infections, and even many moms complain me regarding that. So we are conducting a live session today for our viewers with Dr. who can stay healthy, and this is specially for you all. So I'm waiting for everyone to join in. And also I wanted to share the importance of pranayama for respiratory disease. Yes, for respiratory health. So I welcome Dr. Amit Shah Havama. Just a second, please. I'm asking him to join in. So I welcome Dr. Amit Mishra, who is BMAS and PhD. He is 24 years into Ayurveda and yoga, practicing in Kalyan, Mumbai. So I'm just adding him. Yes.
Hello.
Hello.
Good evening.
Good evening. Hello, doctor.
So happy to be there with your program.
Thank you, doctor, for joining in. So, yes, for further delay, let's start our session with our first question. That is, what are common respiratory issues in monsoon?
Okay, so this, if you see, till now it used to be like cold and cough, then dengue, chikungunya, and
Yes.
these kind of illnesses. But now the things have changed, and now we see COVID variants there. Then we have H1N1, we have monkeypox. So all these viral diseases have cropped up, and we all have to be very cautious, and we have to keep ourselves, our immunity high, so that we are not been affected by the seasonal changes.
Yes. Yes. So, what should be done when one get recurrent cough and cold?
Okay. Now, as I was saying, we need to take care of our immunity. So, immunity
Yes.
will be the first support, and this can be achieved by the proper diet. So, what we are eating, and we should be very careful whether we are eating fresh fruits and fresh vegetables, less of the overnight and stale kind of food, and we should also take care about our sleep. See, being in the
Yes.
city, we always compromise with our sleep. We have the social medias, and then we try to get up at the same time. So our sleep is getting compromised. So we need to have a proper sleep, which is very important. Then we also need to have the proper exercises. This can be in form of yoga, in form of pranayama, or it can be any exercises like going for a walk, jogging. So all these combinations. So we say there are three main pillars. One is your sleep, and
Mm-hmm.
second is your food, and third is your exercise. So three are three main pillars which can contribute to a good immunity, and which can help us to prevent these problems.
Yes. So, what is pranayama and its importance in our health?
Oh, that's a very good question, because many of the people are not very aware of. So if we see, the textbook says Tasmin Sati Swasa Praswasa Yoga Gati Vichedaha Pranayama. So it says that slowing down the inhalation and slowing down the exhalation is pranayama. So what we need to do is, we usually tend to breathe little faster, or
Yes.
we usually tend to breathe little superficial. So what we intend in doing pranayama is that we should be having a deep breathing with deep inhalation and deep exhalation. So when we are having this, we'll be getting more of prana, which is a vital force and which is the vital to our life, which means we can stay without water for some time, we can stay without food for some time, but then if we try to close our nose, if we don't try to breathe, we may not be able to do it for a few seconds.
Yes,
So that
yes.
is why pranayama is very important. Pranayama also helps to lower down your stress. It helps to take care of your blood pressure. It also takes care of the cravings. Like many times, if someone is obese, they want to control their craving. Pranayama does helps in that a very good way. And if we talk about the seasonal changes which is happening, pranayama will help to lower down our stress, and that is how it will build up our immunity. So that is why pranayama and the seasonal change are very much connected.
Connected. Okay. So, okay. So, how pranayama helps to keep respiratory system healthy?
Okay. There is a very beautiful shloka which I would say, Pranassedam base sarvam trividam yat pratishtitam matena putrana rakshasva yashasya shrishcha pragyanasya videha iti. So what the beautiful meaning of is that the whole world is because of the prana. So if we breathe properly, this prana will take care of the individual like a mother. So it's so good, so important to know. See, we have never been taught in our school how to breathe because
Never.
yeah, they feel we all know how to breathe, but the fact is that we don't know how to breathe. So when we are doing the deep breathing, when we are doing the pranayama, what will happen is we will be there is a nitric oxide NO which has been generated when we are doing certain pranayama practices like Brahmari. So when this nitric oxide develops, the attack of the viruses has been minimized. It will helps to cleanse or keep away the viruses. So there are a lot of clinical trials which has been done and which supports that when you are doing pranayama, when you are doing the Brahmari, it will help to keep away the respiratory problems. In the same way, we see a lot of males. They tend to snore in the night time. They are not able to
Yes.
breathe through the nose, and they
Yes.
tend to breathe through the open mouth. So what
Yes.
happens is, if you are doing the regular practices of Brahmari, which is a part of pranayama, then they will be able to keep their nasal tract clear and they will be breathing through the nose and they can also keep away from the snoring. So this is how people from asthma, people who are suffering from the breathing attacks, or who are having frequent allergies, for all these peoples, we have a jalaneti. Jalaneti is a part of the pranayam or part of the yoga, whereby we take the warm water, we put through the one nostrils, and it will get cleared off through the other nostrils. So this
Oh,
warm water with a bit of salt makes a solution which is known as hypochlorous, HOCl. And this HOCl will help to clean the kapha, we keep the tract open. So the people who are suffering from the allergy problems, they can save themselves by doing the regular practices of this Jalaneti and the Brahmari.
okay. That was great. Even the COVID, COVID, the people who suffered from COVID can use that, can do this?
Yeah, in fact, that is a very good question, Divya, because we remember during the COVID time when every one of us was online and we had so much of fear and so much of anxiety. What we
Yeah.
used to do is we used to take online sessions for the people who were admitted in the hospital. So even though they may be on the oxygen or they may not be on oxygen, so we taught them online how to do the pranayama. So what
Pranayama.
happened was, yeah, they were able to reduce their stress. They were able to reduce their fear. And also, they used to get more of prana, more of vital force, that is the oxygen. And that was the reason they moved out of their ICU to the wards. So this has helped a lot of people, and we are very happy to share that people who have been regularly doing the pranayama, didn't need to go down to hospital. In case they need to, their recovery was much faster than the other people.
Of course, yoga is the best, as in. Okay, so what are Ayurvedic ways to manage respiratory problems?
Yeah. See, now the inclination of the Ayurveda towards is increased. If we see the
Mm-hmm.
Ayush Kvad, which was the main thing during the COVID time, which a lot of people use, and this is why more of people are now moving to Vedistry also. So we have
Yeah.
Charak also. So all these people are now moving to these good pharmas who are been coming out with wonderful products. So what does Ayurveda do? Ayurveda works at two ways. One is known as Shamana Chikitsa. So it has the beautiful herbs like we use in our day-to-day kitchen also, like tulsi is there. Then we have haldi, we have ginger, we have dry ginger which is known as suntha. So all these medicines if we are using, it will improve our immunity. It will clear the secretions, the kapha or the mucus will be cleared off, and it is also antiviral in nature. So when we are using these kinds of herbs, or now they are vasa, there are neem, so there are shirish. So these are kind of anti-allergic herbs are also there, which will help us to keep away from the attacks of the respiratory problems. The second
Yes.
thing what we do in Ayurveda is detoxification. That is, we are doing the internal cleansing, which is known as by the Panchakarma. So these are the
Okay.
two ways.
Okay. So the other question is, which herbs are beneficial for respiratory health? Like
Yeah,
this one is many moms are concerned. Like whenever their child also have cold and cough or anything, they are like, what should be the home remedies or what are the herbs which we can use to clear that, other than all medical terms? So can you
yes.
tell me that?
Yeah. Home remedies are the first one which every one of us are using. And for the moms, like the honey is one of the best demulcent, which helps to clear off the kapha. So
Okay.
we have muleti, or we also called as licorice. So they can make the fine powder of muleti, and muleti itself, is little sweet in nature. So it can be usually very well accepted by the childrens also. So honey is also good. It is also sweet in nature, so they can make a paste and then they can allow the children to lick that. So which is also
Yes.
very helpful. Or they can also add to this the suntha, dry ginger. They can make a dry ginger powder. So all these three combinations can be given to them. So it will work as an immediate remedy. So even if somebody is having a sore throat, or little of kapha, or little bit of congestion, so this will be first aid which can be given from the kitchen itself by the mothers to their children.
Okay. So how Panchakarma can help to manage respiratory disease?
Okay. Now this is a very good question because
Just
yes,
second. Just
because sometimes.
just a second.
Yeah, please,
My
no problem. Take your time.
my child had a fall, that's why. Just a
Oh,
second.
is it comfortable now? Please
Yes,
take
yes,
one more
I'm
minute.
comfortable. Just
Yeah,
I'll
yeah.
take a 1 minute, yeah.
Please,
Sorry.
please, 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 please. Sure, sure.
Come. Yes, I'm okay with it.
Yeah, if you want, you can keep him
No, no, no.
along
We
with
can
you.
go on. Yes, my husband
But
is
he,
there. Yes,
okay,
he's
okay.
there.
But he didn't got any injury, no?
No, 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 no. Just hold that way. That's why she wanted me. Then I had to go. Yeah,
Yes,
say.
yes. So you had asked me about the Panchakarma. So that is a very
Yeah,
good question because nobody would like to go down to an hospital.
yeah,
Nobody would like to visit the doctors very frequently. So what
yes.
happens is the Panchakarma, our 5,000-year-old tradition, has given the 5 ways, the Panchakarma, 5 ways where we can detox ourselves. So the Vamana is the first one, whereby if lot of congestions, It may be there in the sinuses, it may be there in the throat, it may be there in your lungs. So what we need to do is we need to drain this. So rather than giving some medicines, so we what we do is we do the Vamana. So Vamana is a 8-day procedure whereby certain medicines will be given for the first 4 days, and for the last 4 days, a little bit of oil massage has been given in the whole body, so that we can help to bring that whole of the kapha to your abdomen, to your stomach. And then on the final day, 8th day, certain medicines are being given so that it can be vomited out. And we have seen a wonderful results. People who have been suffering from frequent asthmatic attacks have been largely benefited because of this shodhan, or the cleansing kriya, which is known as the panchakarma. So that is vamana. The second, which we usually advocate to the people who suffer from a lot of allergy, there is a little change in the environment and then they sneeze a lot. They find
Yeah.
it little uncomfortable sitting before the others, because socially they have to be, they feel very offended. So in that case, we do the nasyam. What we do in the nasyam is a little bit of the steam is been given on your head and the skin, so that the kapha which is there will be liquidified. And then the nasal drops, which will be containing the medicines, the medicated oil is been dipped into both the nostrils in increasing doses for 8 days. So this oil is, since it is sticky in nature, something like the kapha or the mucus, it adheres to, and because it adheres, and then a certain fumes is being given so that the little irritation will be there, and this kapha will drain through the mouth, or it will drain through the motions, so it has been get cleared off. And this goes on for 8 days in the increasing doses. So initially it will be 2 drops, then 4 drops, 8 drops, and likewise. So this nasyam in the panchakarma has also found to be very effective. So I strongly recommend for all the moms and for the youngsters who do not want to use the inhalers and who would like to enjoy the cold drinks, cold ice creams, and they would like to go down and enjoy the rain. So then you should get yourself strong. And initially we need to do this panchakarma, which is very important.
Means it will build your immunity.
It will build the immunity. It will
Yes.
detox the body.
Yeah. So can you give me three simple tips for respiratory health?
Yeah. See, normally we have certain take-home messages. So
Yeah.
take-home messages, yeah, can be like, first is what we eat. How so we are what we eat. So we need to be cautious about what we are eating. So we try to have a large portion, one portion of the fruit, one portion of the vegetable. Try to minimize the fast food so that the body will be getting a lot of nutrition. When body is getting a lot of nutrition, it will be having a good immunity. So this is the first thing we need to do. The second thing is it will be always advisable that we start our day a little early. We can do certain kind of yogic exercises, pranayama, maybe walking or cycling or something like this, so that we can get this sunlight, because sunlight has a lot of vitamin D, and it has been proven by
Yes.
the research, yeah, that this vitamin D will build up our immunity level. So we need to do certain exercises on a regular basis. So this will be important. And in after the end of the exercises, to the cooling down whenever we are doing, we can do little of yoga practices. We can add little bit of pranayama, which is very important. And the third, the most important thing is that we should have an emotional well-being, because now we are all connected through each other through the social media, but we also need the bonding. So it's very important that we spend time with our childrens, spend our times with our family members, with our father, with our mother, because we are all emotional. So when we are connected emotionally, we also tend to have lower stress level, and our emotional EQ, emotional quotient, will be on a higher side, and this will also help us to build up our immunity. So these are the three main things which we need to take care of, so that we can prevent from getting ill.
Yeah. So the other question, the last question is like when one should consult a doctor for respiratory health, like any
Yeah.
kind of respiratory disorders.
Okay. See, what happens is usually whenever we would like, there are certain symptoms or certain signs, which is a warning sign or a warning symptoms which we should know. So, in case if it is a persistent cough, which is also causing little bit of fever, then we have to be cautious. So one is the fever. Second is the breathing rate, how you are breathing. If you are breathing a little bit fast, you are getting short of breath. Nowadays we have pulse oximeter at everybody's home, so you can check the oxygen level. So if this is happening, then we need to go down to a doctor. Third is if the severity is there persistently for more than 7 days. If you feel a cough and cold is there, fever is there, and along with that, little bit of allergy is there. It may be in the form of a rash or any kind of a respiratory allergy is coming, lot of sneezing. So these are the three things. If it has been happening, we should go down to the doctor and we should have their opinion, which is very important.
Okay.
Uh, Before you take the another question, now one more thing which I would like to convey through your channel, Live with Baby, that many of the youngsters also tend to smoke a lot. So what is happening is when somebody is
Yeah.
smoking, yeah, there are a lot of congestions which is happening, and it also reduces our immunity level. So what we need to really take care of is that one should avoid this because it will be affecting the individual. Our lifespan will be shortened. So what we need to do is we are responsible for our own health. So if there is really some stress which is affecting us, so it's better that we'll start doing pranayama rather than looking out for the other ways like smoking or some other ways to reduce the stress. Because this pranayama is a 3,000-year-old science and which was written by sage Patanjali. In fact, everybody thinks that sage Patanjali was the one who started with the yoga. In fact, it's the Adi Yogi, it's the Shiva who propagated, who started with this. And then the writing work was been done by different sages like Patanjali. Uh, who, yeah, okay, no problem,
Just
no
a
problem.
second, doctor.
Yeah, you can, please, please.
Come here, come here. Mahalakshmi is here. Why is she crying? Masha, you want chocolate? You want chocolate? Oh, what are you doing? Mummy, आने ले जा ना 2 minutes खाली. 2 minutes खाली. Yes, doctor. Say.
No, no
Sorry
problem.
for the
Children,
disturbance.
children, children, children
This
need mother. So,
this is
so
what my channel is all about. Life with baby.
yes, yes, yes.
Yeah.
So,
Say.
innocent question is very important. Yeah, bonding is a good.
Yes. Yes. Yes, doctor. So, just close the door, please. Yes. Say.
So I was saying that it was all started the yoga and everything started from Adi Yogi, but it was been written down in the form of a books or in chapters by Sage Patanjali. So whenever we talk about now about the pranayama or yoga, we always take a reference of Sage Patanjali or Sage Vasistha because they made the notes. So documentation they did it for us. So they knew that after 3,000 years, Divya will be asking questions or Divya will be going for the program. So they need to have certain documentation, and that is what has been done by these sages or the
Uh,
rishis.
Okay, so doctor, your tips and facts are really very informative. But I would like to ask my viewers also if they have any questions. Like they have also said, asked me many questions, so we can solve a few questions of theirs as well. There are many moms who have joined our live. So just give me a minute. I'll see the questions that have
Surely, surely,
come
take your time.
across.
Yeah.
Okay. Yep. One of the mom has asked, which is the best home remedy for sore throat?
For sore throat. Okay.
Yes.
Just they want me to speak in Hindi.
Yeah, many are saying that, can you please speak in Hindi?
Okay. Okay. Okay.
Just a
So
second.
uh, सो इसके लिए हम क्या कर सकते हैं, जैसे मैंने पहले भी बताया था कि जो मुलेठी है या जेस्टमद है, उसको अगर हम पाउडर कर लेते हैं और उसको शहद के साथ में मिला के अगर लेते हैं, तो आपके गले में अगर खराश है या थ्रोट हो गया है, तो वो उसके लिए काफी फायदेमंद है। इसी तरह से जैसे घरेलू उपचार में हम अगर थोड़ा गर्म पानी लेके उसमें थोड़ा सा नमक डाल के गरारे करते हैं, तो भी क्या होता है कि ये हाइपोक्लोरस एसिड बनता है, जो कि यहाँ से जो वायरसेस है या म्यूकस है उसको क्लियर करने में मदद करता है।
Just a minute. I'm
प्लीज
so
प्लीज, नो
sorry.
प्रॉब्लम, नो प्रॉब्लम, नो प्रॉब्लम। मदद मस्ट।
Just a second, doctor.
श्योर श्योर श्योर।
Naisha, na kapra juga je. Mama, I'm giving it. Okay, you can take it from me. Mama is doing work. Mama is doing it. Mama is taking care of kapra. Okay, 2 minutes સુધી doctor is there, na? Doctor is telling me everything. Okay, don't cry. See, doctor uncle is telling me everything. Come here. See, doctor uncle.
हेलो।
Very bad for. See, doctor is telling me. Doctor, I'll just a second. Can you give me 2 minutes? Okay.
What is the sweet name of your sweet daughter?
She is Aisha. Her name is Aisha.
Oh, hello, Aisha.
Sadly, that's why I'm so sorry for that.
No, 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 no. So no, no, don't. See, first mother, and that is the need we need to take care of, which is very important.
Another question was, I just saw that. What can be done for the what can be done for sore throat in 9 months old baby?
Okay. For 9 months old baby, yes, as I said, see, the 9 months old baby, since honey acts as a demulcent means which will also help to clear off the kapha. So this can be given to the small baby, or
What
along with
exactly?
this, जो शहद जो होता है ना हमारे घर में, वो
Yes.
भी कफ को क्लियर करने में मदद करता है। तो अगर हम सौंठ का पाउडर अगर कर देते हैं, और जैसे बेबी 9 महीने का ही है, तो उसके साथ में थोड़ा सा सौंठ का पाउडर मिला के अगर देते हैं, और तो मीठा है तो वो आराम से ले भी
You
लेंगे,
make
तो
it
वो
soon?
या सॉफ्ट थ्रोट के लिए अच्छा है।
अच्छा, okay.
शहद शहद के साथ में अगर हम मिला के सौंठ का पाउडर देते हैं, तो
अच्छा.
वो घरेलू इलाज भी है और वो फायदा भी करेगा।
Okay, okay.
मात्रा आपकी छोटी रहेगी,
हाँ?
उसकी मात्रा छोटी रहेगी, क्योंकि 9 महीने का बेबी है, तो आधी चम्मच लेना है।
Yes, what do you want? Cry. Aisha, don't cry. Okay, doctor. So I think
Okay.
if anyone has any question regarding like to ask the doctor, you can ask me right now. Or as we are closing the live, so also I will be saving this live on my profile. If anybody has any question regarding this respiratory problem, they can comment on our live and our experts will, give the advice. So yeah, thank you so
Sure.
much, doctor, for your valuable time. And
Okay.
yes,
Take care.
we can leave the live. Thank you so much, doctor.
Take care. Bye bye.
Bye.